going in one morning and by the end of the day, your kidneys are not functioning anymore.
You wake up the next day passes and whoop, you're back in dialysis.
Having to go and sit down for 3.5 hours, 3 times a week.
I want to live, I want to travel.
Trinidad and Tobago has a significant number of people having end-stage kidney failure.
Over 1,000 patients on renal replacement therapy, which is dialysis, poor quality of life, unable to work.
The foods they can't consume, medications they have to take. My mother had to go with me. If she didn't go with me, I would not have gone on that machine.
I began virtually looking like a skeleton.
It's either you're going to be dialyzing for the rest of your life or you're going to need a transplant.
Trinidad and Tobago is the only country that has actual legislation that governs the procurement, distribution of organs in the English-speaking Caribbean. Our primary objective is kidney transplantation. A treatment option that gives them a longer life expectancy, a better quality of life is very important to us.
I was shattered completely. My sister called me 5 minutes after. She said, you know what? You're not going back on dialysis. Trust and believe. My kidney is your kidney. You're going to get my kidney. I am definitely going to give you my kidney. I was like, well, yeah, let's do this.
But for some people, they may not have suitable relatives or anyone who could donate a kidney to them. And this is where deceased organ donation is important.
Carried out by the transplant procurement managers in the various hospitals. Spain General Hospital, San Fernando General Hospital, and the Eric Williams Medical Sciences Complex. This is where we try to detect potential donors. We carry them to brainstem testing, try to maintain them, and approach the family. If the family says yes, we retrieve the kidneys for transplantation.
There is no cost associated with it. All you get is a good feeling from doing something that outlasts your life.
Would my relative be able to have an open casket funeral? And yes, that would be possible because every care is made to preserve the image of the patient. We try to be as sympathetic and empathetic as possible and to respect the family's wishes.
We are doing something that's very, very unnatural and it's very, very technically challenging. It's amazing that we've been managed to retain services, structure a program, and build it to the point where it is now.
April 2015, that would be my new birthday. I was in the hospital again, going to get transplant.
I wasn't ready to get the kidneys yet, so we donated them. We don't know who they have them, but I know my dad is walking around right now, giving somebody health and strength and a second shot at living a normal life.
At the time, Dr. Roberts called in my name and said, Anne-Marie, your surgery went well and you're producing urine. And all I could have told her at that time was, but I'm feeling to pee.
Along my journey, I lost a lot of friends that had my same complication. And I know it was heartbreaking. We were really close and I loved them dearly.
My husband and I did a pregnancy test and we found out we were pregnant. I think when I did the first ultrasound to confirm the pregnancy and I saw the little spot, and I said, this is really happening. And now I'm at my 4-month mark. Baby is kicking. I'm calling it he for now. I'm enjoying the wonderment of motherhood and expectant motherhood.
Whatever you do and whatever you're going through, don't give up, no matter the circumstances.
You do this with joy.
You know, look at the bigger picture, be positive, look up.
Even in the last minute, there could be a kidney donation.
You can say yes.
And it's like you become a hero.
I eat right, I exercise, I drink a lot of water, and I keep this glow on.
After 4 years of DTI mentoring, counseling, and training, we had an equal number of deceased donor transplants as we had living donor transplants.
35 people who have benefited through the efforts and the work of the TPN, National Organ Transplant Unit, and all our partners from DTI in Spain, PAHO, and Repsol who have made this all possible.
It has been a very excellent relationship. The Republic of Trinidad and Tobago has benefited immensely.
Family life was improved, work life was improved. Life with my neighbors and community definitely took a step in the right direction.
I don't know when my kidneys will come, Why suffer yourself? Eat the things that you like in moderation. Do things you want to do. Pass time until the day comes. And when that day comes, life changes again.
Speak to your loved ones today
about your wishes, because at the end of the day, they are the ones who need to get permission for donation of your organs.
You never know what will happen to any of us or loved ones in later life.
So if you're interested in becoming an organ donor, you could sign up at the Ministry of Health's website
by visiting the National Organ Transplant Unit at Eric Williams Medical Sciences Complex.
Patients are free to just walk in, get information if they express interest. The goal here is to try to get people involved and try to make them aware of the availability of this service in the country.
You can make a difference while living and also after death by signing up to be a deceased organ donor. So sign up.
Make a commitment to become an organ donor.
Drink a lot of water and you become a donor. To be donor. Become a donor.
Become a donor.
Become a donor.
Become a donor.
Want to be a donor?
Become a donor.
Become a donor.
Become a donor.
Become a donor. Become a donor.